Hey everybody, it's Dr. Chappell. Just wanted to post this quick video to get the word out to my patients, friends, family members, anyone that might care on my own personal opinion of what's going on right now. I am a family doctor in Farmington, Utah for the Ogden Clinic, and I wanted to give you my own take on everything, mostly because I want this to end. I want my 401k to rebound. I want to be able to retire someday. I want my own job, the job of my neighbors. I want them to keep their jobs, to be able to earn a living for their families and support them. We really want our kids back in school so they can continue their education. And I'm sure my wife would speak to that. And we want an end to this anxiety and uncertainty over what's going on, from where am I going to get my next gallon of milk or toilet paper. So why is it important? Why is this coronavirus thing important? Out of the 250,000 cases worldwide, we've had about 10,500 deaths. That equates to about 4% mortality rate. If you compare that to the flu, which the flu in the last few years causes about 30 to 60,000 deaths a year in the United States alone, its percentage of death for people that get it is approximately 0.7. So this is 5 to 6 times stronger than the flu in causing people to pass away, or more deadly. How do you get it? Respiratory droplets. It's coughed into the air. The viral droplets are in the air within 6 feet of the person that coughs for up to several hours. And as you breathe it in, their cough or their sneeze or their touch on a doorknob, you touch it and touch your eyes or your face, you get it. And it is very contagious. It's the common cold turned bad. And so highly, highly contagious. What does it cause, or what are the symptoms? Of course, we know fever, chills, body aches, cough, shortness of breath. Those are the main symptoms. However, the incubation period, or the time frame from when someone gets the virus to when they show symptoms, on average is 5 days, and the range is 5 to 11.5 days. So you could have this virus for 11 days and give it to everyone around you, and you wouldn't even know it. So one of the biggest problems we talked about is testing. As a family physician here in Farmington, Utah, I can order the test for COVID-19. However, the test will only be done on those that are high risk because we do not have enough tests right now. We are getting those tests, and we will have them soon, I hope. But as of right now, it is only for those who are high risk, which is the elderly, immune compromised, people that have traveled or been exposed, healthcare workers that have symptoms. So most of my patients that I think might have COVID-19, I cannot test, and I will not test them. That poses one problem in that we don't know who has it, who doesn't have it. So how do we stop this and get our lives back to normal? Stay home. Just stay home. Don't go to work. Take your sick days. Don't go to the grocery store. Don't go anywhere. Just stay home. There was a woman in Seattle, or in Washington, I recently heard on the radio. She was sitting with friends at a restaurant having lunch a couple weeks ago. That's how she got it. None of them were sick. None of them touched each other. They were just in close proximity. Most of them got it. And the only way she found out is through some other special testing that wouldn't have been done now. Stay away from family, friends. Don't have people over. Don't go anywhere. Just stay home.